Hi, I'm Dr. Miner. Today I'm here with a patient that we are going to do a root canal for. And tell us a little bit of what's going on with this tooth.
Well, it's been a little sensitive for a time, but about 2 weeks ago it started to give me, started to stay painful, and it was hard for me to eat anything on it for about 24, 48 hours. And then for whatever reason it doesn't seem like it's bothered me much for the last 10 days or so.
Okay, so typically what's going on with that is the pain comes from the tooth dying. And so then once it's dead, we could say, the nerve isn't feeling anything, and so it typically starts to feel okay. But then that's deceiving, because at some point pain will come on with a vengeance. And so we're taking care of this now while the tooth feels fine. But it's, you know, the nerve inside has died. We're going to clean that out, do a root canal, and be able to keep the tooth. So as we do this root canal, a lot of it's kind of, you could say, the traditional way. You know, we're going to make a hole in the tooth. We're going to use some instruments to go down in there and clean out the material that's in the root, the dead stuff. But the thing that's going to be different is that we are going to use the laser in the end to disinfect the tooth. And the laser has the highest disinfection ability of any mechanism that's out there. And the way it works is that the laser light is able to penetrate sideways into the tooth and kill the bacteria that are embedded on the sides, and penetrate into the sides of the tooth the furthest out of anything that's out there. So we're going to really clean this tooth out and expect a great result. Alright, so we're going to use the laser now. And we're going to finish kind of cleaning out the tooth. And it seems like he's asleep, so he may not even notice what we're doing.
What are you
Oh, you're awake.
I'm asleep.
Yeah,
You were snoring.
Oh, please.
Alright, so we're going to finish cleaning out the tooth with the laser. And what we do with that, we have a little bit of water going with it. And we're going to stick this down into the canal here. Okay, we're going to do a few passes, and then we're going to change our setting on the laser. We're going to do a few more passes, and that's going to disinfect, and then we're ready to fill it. Okay, so how did this experience go for you?
Well, what can I say? When you're good, and it just went smooth as could be. And I am astounded that it was so effortless and painless that I actually dozed off during the procedure. But it's wonderful to wake up and have a brand new root canal.
Yeah, and that was without drugs. So, and then we did use the laser to disinfect, and you could tell a little bit. You had a little sensation with that,
yeah,
right?
For sure, you could feel that in there each time you went in to disinfect it. But that's impressive. The technology has come that far, and that you're that current and state of the art. Thank you so much.
Well, thanks.
Thank you.